What other options are available to root canals? Root canals are a typical treatment for dental problems that is usually suggested when a tooth gets damaged or infected. Though they are successful in saving a tooth as well as relieving discomfort, they can also be an expensive and lengthy procedure. If you're looking for alternatives to a tooth canal, there's a number of alternatives available. 1. Extraction. A different option to having the root canal procedure is having the tooth removed. Though this could seem an unorthodox option, but in certain situations it may be the best solution. When a tooth has been severely damaged or is infected and cannot be saved using the use of a root canal, extraction might be the best option. In certain situations, extraction might be a better, more economical and quicker alternative than an actual root canal. 2. Pulpotomy. A pulpotomy is an operation like an actual root canal, however it is much less painful. A pulpotomy is a procedure where only part of the pulp in the tooth is removed instead of all of the pulp chamber. This is an excellent choice for people who have minor damage to their tooth but are not in need of a complete root canal. 3. Medication. In certain instances, teeth that are damaged or infected might be treatable using medication instead of an extraction. There are antibiotics that can aid in fighting infection, as well as pain relief medications can help ease the discomfort. Though medication isn't always going to be the best solution for all situations, however, it could be beneficial for patients that are unable to undergo root canal surgery. 4. Dental crowns. Another option for an in-depth root canal treatment is having dental crowns placed on the tooth. The crown is able to defend and strengthen teeth that are damaged or infected, which can avoid the necessity for the need for a root canal. Crowns can be constructed from different materials, which include porcelain, metal, or a mix of the two. Though a dental crown isn't an all-time solution, but it could be an ideal option for people that are unable to endure a root canal procedure or want an easier treatment. 5. Reversible pulpitis. Reversible pulpitis is that occurs when the pulp inside teeth becomes inflamed and it is still able to be healed in its own. In certain instances, teeth that are affected by reversible pulpitis could be able of being treated through medication as well as excellent oral hygiene techniques and without requiring the use of a root canal. But it's crucial to consult your dentist as soon as is possible when you're having any indications of reversible pulsatilla, since the problem can become worse in the absence of treatment. Although root canals are commonly used and successful treatment for infected or damaged teeth, other alternatives are offered to patients searching for an alternative. If it's the extraction of a pulpotomy or the use of dental crowns or medication or reversible pulsatilla, there is a myriad of choices that you can consider. You should consult with a dentist in order to decide what is the best option depending on your specific circumstances. Be aware that the sooner you begin seeking an appointment for treatment of a damaged tooth, the greater chance you will have of preventing needing root canal.